Hello everyone, my name is Tracy Farraher and I'm an epidemiologist at the University of Manchester. I use data to explore what factors are associated with health, as well as differences in health between different communities and what interventions work to reduce these inequalities. This presentation is part of the European Public Health Week of the 13th to the 17th of May 2019, which is led by the European Public Health Association to raise awareness of public health and celebrate healthy populations. In this first ever European Public Health Week, there are a range of events and activities all over Europe, with each day dedicated to an important public health theme. Each day, I'm going to provide a quick summary of some of the evidence of the health benefits of each day's topic, with links to further information. I hope this provides you with a short introduction to the importance of each day's public health theme. So on the fourth day of the European Public Health Week, the theme is Sustainable and Healthy Diets, and the motto of the day being a healthy diet while taking care of our planet. The sub-themes of this day are healthy diets, sustainable agriculture, food production, food system transformation, food safety laws, fat tax and sugar tax. We're going to look at the evidence, the health benefits of a healthy diet. Our diet contributes in many ways to our health. The World Health Organization have collated a range of data from across the world to understand which factors contribute the most to worldwide deaths, and they identified 24 risk factors within nutrition, physical activity, addiction, sexual health and environmental risks that had a global spread and for which the means to reduce them is known, and these are known as modifiable risk factors. We saw this bar chart on Monday that shows the deaths that can be attributed to the leading 19 risk factors. If you start to think about these factors, you can begin to think about how a number of these are related to diet. Be that directly, such as salt intake and high blood pressure, or saturated fat and cholesterol, or the general links between poor diet and physical activity with obesity, and obesity's subsequent links to a range of risk factors and poor diet. In their report, WHO looked in more detail at 6 risk factors that were diet related: high blood pressure, high blood glucose, physical activity, overweight and obesity, high cholesterol, and fruit and veg intake. The 6 risk factors account for 19% of global deaths. These risk factors have the greatest effect on cardiovascular diseases. 57% of cardiovascular deaths can be traced back to one of these risk factors. Let's just look at fruit and veg consumption, which is just one element of a healthy diet. Insufficient intake of fruit and veg is estimated to cause around 14% of gastrointestinal cancer deaths, about 11% of ischemic heart disease deaths, and about 9% of stroke deaths worldwide. Now let's look at diet's contribution to the burden of disease. The burden of disease attributable to risk factors is measured in terms of lost years of healthy life, using the metric of the Disability Adjusted Life Year, or DALY. One DALY can be thought of as one lost year of healthy life, and the burden of disease can be thought of as a measurement of the gap between current health status and an ideal situation where everyone lives into old age free of disease and disability. The 6 risk factors related to diet account for 7% of global DALYs. As you can see in this bar chart, the disease burden varies across the regions of the world and how much of the lost years of healthy life that can be attributed to these 6 risk factors also varies. The bar chart shows the DALYs lost per 10,000 population due to the 6 risks for high income countries and for low and middle income countries grouped by WHO region. In all of the regions other than the Western Pacific, the low and middle income populations lose more DALYs because of these 6 risks than populations in high income countries. The attributable burden of disease per capita is actually greatest in the low and middle income countries of Europe. Thank you so much for your time. Further information on the impact on health of healthy and sustainable diet, as well as today's sub-themes, with listings for the events for today and the rest of the week, can be found at the European Public Health web pages on eupha.org website, including links to my other evidence summaries. To get in touch with me, I'm based at the Division of Population Health, Health Services Research and Primary Care at the University of Manchester in the UK, where I'm also a member of the I3HS Hub that aims to improve population health through data sciences. You can follow the Hub at I3HSH and myself on Twitter at tfarraher. Again, thank you, and I hope you found this quick summary of some of the evidence of the health benefits of a healthy diet useful.